Hey everyone. Okay, video today is just going to go over some basic medical stuff. First off, this is a 10 Tac Medical Tips card, smart card, from Dark Angel Medical. Kerry Davis, former pararescue, Air Force Special Operations medic, you know, the real high-speed guys. Started Dark Angel Medical many years ago, and they make fantastic products. I use their dark, what they call their dark kit. It's a enhanced IFAC system. They also make a bunch of other great products, including a wound cube, which is a great medical training device, and they do stop the bleed courses, advanced medical, tactical medical courses, tech and TCCC training, and like all that kind of stuff. Okay, so Dark Angel Medical, highly recommend these guys. But they used to, I don't know if they still do anymore, but they used to include these 10 Tac Med Tips smart cards in with their products when you purchased them. So we're going to go over the numbered points here on this smart card, because this is really good basic medical stuff for people to know and to train up on, okay? And this is really for your everyday stuff, okay? Your everyday preparedness type stuff. First point, you know, stop, assess the scene, safety, and call 911. Put on your gloves, okay? So, do you have PPE with you? Assessing the scene, is it safe to continue to render aid? Do you have to stop a threat? You know, whatever it is. Disaster situations, has the event, the disaster event, finished? Is there still ongoing risks? Is a house going to collapse? Is a gas line going to explode? Whatever it is, you know, the situation there, okay? So stop and assess the scene safety and call 911 if you're able to. If 911 is operating, and put on your PPE, put on your gloves. Number 2, check the victim's level of consciousness while approaching by calling out to them. So, you know, at a distance, like, hey, are you okay? You're approaching, you know, assessing things. Number 3, check for any life-threatening hemorrhages and stop it. So this is where your stop the bleed stuff comes into play. What kind of bleeding, if there is any, you know, what's going on there? Is it vascular bleeding? Is it an arterial bleed? Is it a serious thoracic or torso wound? You know, what is it? What is it? What's hemorrhaging? What's bleeding? That's priority to stop the bleed. Okay. Number 4. Check for any airway problems and correct them. So that means, you know, checking the tongue, doing the sweep. If you have CPR training, that's going to be something that they teach you in CPR, okay? So you should get CPR training, you know, pretty common sense, okay? So clearing the airway. Number 5, check for any difficulty breathing. So look, listen, and feel, okay? Again, looking for chest rise, you know, checking for pulse, listening for heartbeat, feeling for the pulse, checking the airway, all that stuff. All right, number 6, check the radial and carotid pulses, capillary refill, skin color, and temperature. So capillary refill is something with like your fingernail. So you push on that, it pales out, and you see how quickly it goes back to color. Okay, that's one thing to check. So, and then you're checking, you know, on the neck for carotid pulse or radial pulse, like in the arm or the leg, you know, and then checking overall skin color. Are they pale? Are they blue? Are they turning green? You know, whatever. And their overall temperature, okay? And it continues on the back. Number 7, assessing the level of consciousness, the LOC, again, using the AVPU scale. So A is alertness, okay? Person, place, time, and situation. V, response to verbal stimuli. P, responds to painful stimuli, such as in a sternal rub, you know, your knuckles on the sternum, a skin pinch, something like that. Or they're unresponsive. Remember to constantly reassess the LOC, as an alteration in LOC can mean a shortage of blood, sugar, or oxygen, which the brain loves. Assess the pupils. Are they reactive and equal in size or diameter? So, some of these things, look what they're talking about. Hey, diabetic issue could be a thing. Heart attack could be a thing. Okay, so it's not just traumatic, visible traumatic injuries, serious bleeding, wounds, gashes, gunshots, things like that. It could be another kind of medical issue. And I've talked about this before, and this card really does a good job of covering it, along with proper training courses with Stop the Bleed, as well as your CPR and AED classes, BLS, Basic Lifesaver courses, and as you advance, and then doing TCCC and tech courses and things like that, okay? So look over this stuff. Number 8, expose the victim for any further injuries, treat as necessary, and cover the ground the victim is lying on, and cover them to prevent heat loss, and place in a recovery position, so that's on their side, if injuries allow. Okay, so again, they have a broken neck, back, hip kind of thing. It's going to be difficult to put them in a recovery position per se, unless you have that kind of injury stabilized and rigid and isolated. Even with neck and back injuries, you really do not want to move the person, but you still need to support those areas with a makeshift cradle, or if you have a C-spine or something like that, some kind of medical device to assist in that kind of thing. But further assessment, continual assessment, and checking for additional injuries, and making sure that they are comfortable and you can try and regulate their temperature, their body temperature. Number 9, treat for shock. Continue to assess for any bleeding and keep them warm, like we just said, okay? So there is a little bit of redundancy here, but it is necessary redundancy. With medical, redundancy is very necessary, okay? Number 10, constantly reassess any intervention, reassure and talk to the victim until help arrives. Again, depending on the situation, that could be a very long time, especially, say, a natural disaster. It could be very difficult to get to your area, so you're going to be with the victim for a while. Also, in austere conditions or in a combat zone and things like that, it could take up to an hour. There's kind of that golden hour rule in the combat environment that CASEVAC is most effective when you can get the victim or patient to medical care within an hour, okay? There's a lot of factors, a lot of different exigent circumstances in your daily preparedness and preparing for emergencies and situations, and having the right training and equipment with you for your day-to-day kind of stuff. And we've talked about this before, but this is just a really good way for you to be able to have a quick reference guide, especially in the heat of the moment. Sometimes with adrenaline and things like that, people will forget things or they miss something or whatever. This is a good reference to go back to, along with continual training and practice, okay? Medical training is great, and everybody needs to get medical training. Not just, so you need CPR at AED, you also need some kind of stop the bleed training, to whatever degree of advancement that is, whether it is just a basic stop the bleed course or something more advanced, being tech or TCCC or BLS, whatever it may be. Get that training and put it into practice. You do need to practice these things. Also, check your medical equipment to make sure that anything that's expired, a considerable amount of time expired, that needs replaced is replaced, okay? And various medical items, SAM splints, anything from SAM splints to tourniquets and things like that, you should have multiples of, okay? There's a lot to cover with medical equipment and stuff, but I find that this card is extremely useful for people, and more medical equipment companies should be providing something like this with their products to assist somebody in the process of rendering aid and responding to an emergency, as much as it is providing their products and training, okay? So big shout out to Dark Angel Medical for providing this kind of stuff. I've had this card for a long time because I use their products for a long time. highly recommend them. But this is just one of those things I wanted to go over with people. Just a quick reference card, and you can go back at any point in this video, pause it, and read these points, and kind of, you know, make notes for yourself and whatever else. But more companies should be doing this kind of stuff too. Very useful, very helpful, and it can save yours, your family's, your friends, or some stranger's life in the future. You never know. Get training, apply it, make sure you're up to snuff with your medical equipment, and that you have extras of your medical equipment. And yeah, just stay prepared for everyday stuff. Anything from a car accident to somebody has a heart attack in a grocery store parking lot to a major natural disaster event that injures a lot of people over a wide area, to something much more serious with something elsewise much more serious in the, you know, the realm of a combat, you know, a battle or something. Somebody gets shot in a drive-by, but you're there and able to render aid if the scene is safe. Whatever it may be. Whatever it may be. There's a lot of everyday examples that can come into play with this kind of thing. But, again, this is very useful stuff right here, okay? So, make sure that you're getting training and you're getting equipment and keeping up to snuff with your training and your equipment and everything, okay? That's all I got for you today. Metal up. Out.